Hi, my name is Dr. Karen Gellin and I'm a pediatrician at English Road Pediatrics. In this video, I'm going to talk to you about both starting and advancing solid foods in your infant. When we're talking about this, it's important to remember that the American Academy of Pediatrics recommends that babies are exclusively breastfed for the first 6 months of life. So especially if you are nursing your baby, it may be helpful to wait until closer to 6 months to start solids. That being said, many babies are ready to begin solids somewhere between 4 and 6 months. Things that I look for in terms of whether a baby is ready or not. They have to be at least 4 months old. So we know that before 4 months of age, guts in babies do not tolerate solid food very well, and they may become fussy and gassy. So I would avoid it until at least 4 months. Other things that I look for is babies should be able to hold their head up well when in a supported seated position, such as a high chair. And finally, some babies are really interested in food. And the way I talk to parents about that is they will say that when they are eating, their baby is staring them down. That can be a sign that babies are interested. So if your baby is meeting all of those criteria, it is something to think about with starting solid foods. And of course, you can always talk about with your pediatrician if you're unsure if your child is ready. So when you are starting, traditionally, rice cereal has been the first thing that has been used. The nice thing about rice cereal is that you can adjust the consistency really well. So rice cereal is essentially a powdery flake that you mix in with breast milk or formula. The downside about rice cereal is it does make some babies constipated, and honestly, the nutritional value of cereal is not very high. So some families will start with either fruits or vegetables, and that is perfectly fine. You can either make your own food or buy food. If you are buying food, you want to buy stage 1 foods first. So stage 1 foods essentially are if you bring it up on a spoon and you turn the spoon to the side, the food will just dribble right off of it. So if you're making your own, you're kind of looking for that more dribbly, thinner consistency. And start with just once a day. I like to start actually in the morning because babies are often more awake and more willing to try new things in the morning. It also does not matter whether you start with fruits or vegetables. A lot of people say you have to start with vegetables because fruits are too sweet and then babies won't want to eat vegetables. That's actually not true. And so there's no rhyme or reason to where you start. Pick one to start with, and then you can do, if you start with a vegetable, you can do the fruit second and alternate so that you introduce your baby to a variety of foods. I'd also recommend waiting 3 days in between introducing new foods. While most babies do just fine with introduction of solids, if there are any concerns about allergies to foods, waiting a few days in between can help you identify which food may be causing the problem. So between 4 and 6 months, you're really starting with these early foods, and you may increase to 2, potentially even 3 times a day over that time frame. If you are starting solids closer to 6 months, or even if your baby has been doing it for a couple months already, around that time is when babies are ready to switch to stage 2 foods. And stage 2 foods, when you pick them up on the spoon and turn the spoon to the side, cling to the spoon for a second before plopping back into the bowl. There are some foods that are what I like to call a natural stage 2 consistency. For instance, yogurt is essentially a stage 2 food. And at 6 months, it's okay to introduce some of those natural stage 2 foods as well. With yogurt in particular, some parents ask, well, that's a dairy. Aren't we not supposed to give that until babies turn 1? And this is a point that's actually a little bit confusing. So the reason we do not recommend cow's milk, which is what most of us drink, until age 1 is because it is a very poor source of iron and does not contain all the nutrients that babies need between 6 and 12 months of age. Dairy by itself is actually okay to give. So things like yogurt and as babies get a little older, cheese are fine to give before age 1. It's just that milk should not replace breast milk or formula until age 1. So let's get back to the solids. So now that it's 6 months and you're doing stage 2 foods, most babies are feeding about 3 times a day. And the serving size is somewhere between 1/4 to 1/2 cup per item. So for instance, if for lunch you're giving your baby both a fruit and a vegetable, you want to do 1/4 to 1/2 cup of each item. As babies get closer to 8 months, they start to develop some new skills with their fingers. Namely, they move from the claw to pick anything up to being able to pick things up with their finger pads. So when you start to see that is around the right time that babies are ready to start finger foods, which is a really fun yet messy time. Enjoy the mess. It's actually quite fun. So at that time, as long as food is small enough, so cut up small enough, or a soft enough consistency, you can give your baby almost anything. So notable exceptions. Do not give your baby honey until they are at least 1 year of age, because there is a risk of something called botulism. The other thing to look out for are choking hazards. So hard, round objects in particular, and especially even if they're not hard, but round objects can be choking hazards. So nuts are both hard and round and not a good option. Things like grapes, hot dogs that are cut up into circles, those are not hard, but they are round and they are easy to get lodged into the airway. Other hard objects like raw vegetables, none of these things are good options for your baby as they're learning to feed. So just think small and soft, and then it's okay. That includes things like it's okay to give them meat. It's okay to have them let fish that flakes up really nice. It is okay to have strawberries and eggs. So many of these things that back in the day they said don't give your infant, it's not true. What we actually know is that the earlier we give babies these foods that tend to be allergic inducing, the less of a chance they are likely to have the allergy. Particular note about peanut butter. So for most babies, giving peanut butter early is actually a really great thing that can help reduce their chances of having a peanut allergy. That being said, if your particular child has had severe eczema, if they have had any difficulty breathing, so particularly wheezing episodes, or if there is a strong family history in a first-degree relative, so a sibling or a parent who has a peanut allergy, please talk with your pediatrician before beginning peanut butter. They may recommend that you see an allergist before introducing this food. As you get to between 9 and 12 months, babies will start to transition so that the vast majority of their nutrition will start to become from solids instead of from liquid food. So you may notice them decreasing how much they want to nurse or how much they want to drink out of a bottle. And that's okay. That's a normal thing. Some parents come in concerned and say, my baby refuses to eat any baby food. They only want to eat real food. This is an excellent problem to have. When your baby turns 1, you essentially want them to be on a similar diet to what you eat. So encourage them to keep using solid foods. Let them use their fingers to start feeding themselves. If you're having the trouble of you're feeding your baby with a spoon and the baby just continues to grab the spoon, my recommendation is to use 2 spoons, one for them to play and one for you to help feed them. So starting solids and advancing solids is actually a really fun time for both parents and babies, so certainly enjoy it. And as always, if you have any questions or concerns, please don't hesitate to talk with your pediatrician. Enjoy feeding.